Hello, Stoughton families. I am Allie Hughes, the school nurse.
And I'm Nancy Warden, the Educational Services Coordinator.
At Stoughton Schools, our goal is to provide a sound education while keeping your child safe and healthy. We put together this video to help families navigate and understand the updated guidance that has been released by the Illinois Department of Public Health and will be implemented at Stoughton Schools moving forward.
Unfortunately, this year looks very different in the way we may be sending students home for symptoms compared to what we've done in previous years. With the onset of COVID this past spring, our practices had to change with the pandemic in order to mitigate the spread of the virus in our schools. These practices that will be put in place are in place to keep our students and staff safe as our district works to provide the best education we can. We appreciate your kindness and understanding during this time.
The Illinois Department of Public Health has advised to send home or deny any entry to any student and their siblings for any of the following symptoms: a fever 100.4 or higher, new onset of moderate or to severe headache, shortness of breath, new cough, sore throat, vomiting, diarrhea, abdominal pain from an unknown cause, new congestion or runny nose, loss of sense of taste or smell, nausea, fatigue from an unknown cause, or muscle or body aches.
We realize that many of these symptoms may be related to other illnesses such as strep throat, viral colds, GI viruses, or the flu. As a district, we can't differentiate between these illnesses and are going to err on the side of caution. This helps us limit the spread of the illness throughout the buildings. Any evaluation by a doctor is strongly advised for students who have these symptoms for clearance to return to school.
If you choose not to take your child who is experiencing symptoms to the doctor, your child will need to remain home for 10 calendar days.
If any person in your household is being tested for COVID and is awaiting the results, we ask that that student remain home until negative results are received. If the test is negative, these results need to be turned into the school office in order for the child to return to school. If there's a positive result, quarantine results outlined by the health department will be in effect. A note from the doctor releasing the student back to school will be needed in this case as well.
If your child is exhibiting any of the previously mentioned symptoms, please call your school's office and notify them of your absence and your symptoms. Remember, all siblings must stay home until proper action has been taken. Once your child has been evaluated by a doctor, they must bring a medical note stating that there is no clinical suspicion of COVID-19 and indicate an alternative diagnosis.
Please remember to continue to send your child to school with a mask to wear in and an extra mask just in case this mask breaks or gets dirty. We also suggest you send a water bottle. We encourage you to remind your children to wash their hands frequently.
If you have any further questions, please do not hesitate to reach out. I myself will answer or find someone who can answer your questions.
Thank you all for your time and stay healthy and safe.